What is hospice? Hospice is specialized comprehensive medical care for patients who have a 6-month prognosis. It's a doctor's best guess. It actually takes 2 doctors to say that somebody has a 6-month prognosis. Then, since it is a best guess, that's why people can graduate from hospice or they may stay on hospice and qualify longer than a year. I'll be doing videos on how to know if someone is eligible for hospice based on disease state and overall condition. So if that interests you, give this video a like so I know. And it's estimated that 1/3 of patients discharged from a hospital setting would qualify for hospice. 1/3. So that's why one of the triggers for hospice is if somebody has had 3 or more hospitalizations in the past year, they most likely would qualify for hospice. If you or a loved one has a serious illness, take time now to go ahead and plan. It takes time to research various hospice agencies in your area to know which one to go with. I'll show you what website to use to help find the hospice agencies with the highest quality ratings. First, you can either Google or go to a website or just go to a search browser, and you're going to enter in Medicare Hospice Compare. So Medicare Hospice Compare and look for this website. And then on this website, then you'll enter in your location. You can enter in your zip code, and then it'll show the various hospice agencies that are available. This is showing there are 22 hospice agencies in the area, and they're all by alphabetical order. And you can just glance and look that when you within your list, you're going to be able to see the number of stars, so you can look at their overall family caregiver survey rates. And so these are how you can go to look at which are the quality hospice agencies. And once you click on each individual hospice agency, it will show the different medical conditions and the percentage patients with that condition that they treat. It also will show the location of care, but more importantly, it will show on the next slide. More importantly, it will show both family caregiver experience as well as quality of patient care. So let's click on family caregiver experience so you can see what it shows up. So when you're looking at the caregiver experience, it's what is the communication with family? How would they rate it? And it says higher percentages are better. What about getting timely help? Like that's important for if you're calling with an unmanaged symptom. Are they going to be able to help you right away, or is it something you're going to have to wait for hours or days? Treating the patient with respect, emotional and spiritual support. And then there's your help for pain and symptoms. And if you scroll down, the very bottom is willing to recommend this hospice. And that is one that you can look at. Higher percentages are better. Once again, national average is 84%. So this hospice company, which is not one of the ones that I had listed, but I had scrolled through and found a 4-star review. 85% of people would recommend that hospice compared to this hospice agency, which it's all the way at the very bottom, but only 64% are willing to recommend this hospice. This one hospice agency that is listed, it was only a 1-star review, and you can see all the numbers. If the national average, is like 81% or in the 70s, they were only getting timely help at 58%. Help for pain and symptoms, 62%. So that's why it's super important to go to that website, Hospice Medicare Compare, and then enter in your zip code so you can see which hospice agencies are available, and then click on the individual hospice agencies with the high numbers of the high number of stars, and then you can see, willing to recommend this hospice. And then from there, then you can make your phone calls to meet with the various hospice agencies, and then you can make your decision from there, because you have the right to make the choice.